You're sitting across from your doctor. She's studying an MRI scan of your brain, and she says something that doesn't quite make sense. Your brain looks younger than it should. Not by a little, by almost a full year. And the reason isn't some experimental drug or genetic lottery. It's something you did every Tuesday and Thursday for the past 12 months. You went for a walk, a jog, a bike ride, that's it, and somehow your brain rewound the clock. That scenario isn't hypothetical anymore. A 2025 randomized clinical trial just proved it's real. And today, we're going to break down exactly how it works. More importantly, we're going to show you the exact exercise protocol that made it happen. No gym membership required. No special equipment. Just consistent movement. Because here's the thing about your brain. It's not fixed. It's not declining on some unstoppable schedule. It responds to what you do. And we've got the scans to prove it. First, let's talk about what brain age actually means. Because it's not just a metaphor. It's a measurable thing. And measuring it required some clever science. Researchers trained machine learning algorithms on thousands of brain scans from people of known ages. The AI learned what a typical 40-year-old brain looks like versus a 60-year-old brain. Gray matter volume, white matter integrity, the thickness of your cortex. All these structural features change as we age, and the patterns are surprisingly consistent. So now when you slide someone into an MRI machine, the algorithm can look at their brain and make a prediction. This brain looks like it belongs to someone who's 53 years old. If you're actually 53, your brain is aging typically. But if you're actually 57, your brain looks 4 years younger than your birthday suggests. That gap has a name. Scientists call it brain-pad brain predicted age difference. And it's not just a number on a screen. Research suggests it correlates with actual cognitive function and brain health outcomes. A 2025 study in GeroScience examined 211 cognitively healthy adults, averaging age 71. Those with younger brain ages performed better on memory and processing speed tests. So brain age isn't just academic curiosity. It's a real marker of how well your brain is holding up. And here's where exercise enters the picture. For decades, we've known exercise helps the brain, but most studies relied on cognitive tests, memory quizzes, reaction time measurements, useful but indirect. The question researchers wanted to answer was more fundamental. Does exercise actually change the physical structure of your brain? Can we see it on a scan? In 2025, a randomized clinical trial published in the Journal of Sport and Health Science set out to answer exactly that. They recruited 130 healthy participants aged 26 to 58. Half were assigned to an aerobic exercise program. The other half served as controls. Everyone got brain scans at the start, and again 12 months later. The exercise protocol wasn't extreme. 2 supervised 60-minute sessions per week, plus additional home exercise. The target, 150 minutes of moderate to vigorous aerobic activity weekly. That's roughly 20 minutes a day most days of the week. Walking briskly counts. So does cycling, swimming, jogging. Nothing that requires a personal trainer or expensive equipment. After 12 months, the researchers compared brain scans. The exercise group showed significantly reduced brain-predicted age difference compared to controls. Their brains looked measurably younger. But here's where it gets really interesting. The benefits weren't just present or absent. They scaled with fitness level. The fitter you got, the younger your brain appeared. Every standard deviation increase in VO2 max, that's your maximal oxygen uptake, the gold standard measure of cardiorespiratory fitness, was associated with a brain that appeared 1.83 years younger. To put that in perspective, a standard deviation improvement in VO2 max is roughly 7 milliliters of oxygen per kilogram of body weight per minute. It's achievable, not easy, but achievable. The study authors noted something important in their findings. Quote, higher cardiorespiratory fitness was associated with younger brain age, suggesting that the relationship between exercise and brain health may be mediated through cardiovascular improvements. In other words, exercise doesn't just affect your muscles. It improves blood flow, oxygen delivery, vascular health. And your brain is utterly dependent on those things. Here's another finding that caught my attention. A separate 2025 study in GeroScience looked at lifestyle factors more broadly, not just exercise but sleep, social engagement, cognitive activities. Among 211 cognitively healthy older adults averaging age 71, those with more active lifestyles showed younger brain ages based on Alzheimer's biomarkers, not just general brain age, specific disease-related markers. Now, I want to be careful here. Younger brain age doesn't guarantee you won't develop Alzheimer's or other cognitive issues. The research shows correlation and mechanism, not certainty. Your genetics matter. Your history matters. But what the evidence suggests is that you have more influence over your brain's trajectory than we used to think. There's some nuance worth mentioning. A separate analysis found that more exercise isn't always better. Extreme training loads didn't produce proportionally better brain age results. The sweet spot appears to be moderate, consistent activity. Not crushing yourself daily, not running ultramarathons, just moving your body regularly, week after week, year after year. Think about that for a second. The intervention that showed brain age benefits wasn't some elite athletic program. It was walking, biking, swimming for about 20 minutes a day. So let's talk about what this research suggests you might consider doing, because data without application isn't particularly useful. The study protocol targeted 150 minutes of moderate to vigorous aerobic exercise weekly. That's the same number you've probably heard from general health guidelines. It's not coincidence. Moderate intensity means you breathing harder than normal but can still hold a conversation. You might say, your heart rate is elevated, maybe 60 to 70% of maximum, but you're not gasping. Vigorous means you can only manage a few words between breaths. Both count toward your weekly total, and you can mix and match however works for your schedule. Consider tracking your cardiorespiratory fitness if you have access to the tools. Many modern fitness watches estimate VO2 max. It's not perfect, but it gives you a trend to follow. Here's something the research really drove home for me. The study participants exercised for a full year before the brain scans showed significant changes. This isn't a quick fix. Consistency matters more than intensity. Showing up 3 times a week for 12 months beats crushing it for 6 weeks and then stopping. Your brain responds to sustained signals. And here's a thought that might help on days when motivation is low. You're not just exercising for your body today. You're making a deposit into your brain's future. Now, I want to address something important. This study included healthy participants aged 26 to 58. Different populations might see different results. If you're older, younger, or managing health conditions, the protocol might need adjustment. That's a conversation for you and your doctor, not a podcast episode. This content is for informational purposes only and is not a substitute for professional medical advice. Always consult your doctor or a qualified healthcare provider before making changes to your health routine. But here's what I find encouraging about this research. The intervention wasn't complicated. It wasn't expensive. It was regular, moderate movement. That's it. The brain-predicted age difference provides, as researchers put it, a single interpretable metric for understanding how lifestyle interventions affect the aging brain. What that means is we now have a way to actually see, whether lifestyle changes are working. Not just feel better, not just score higher on a memory test, but visible structural changes. So here's a practical framework you might consider. Start where you are. If you're not exercising at all, begin with brisk walking. Even 10 minutes helps. Then build gradually. Try to include activities that genuinely elevate your heart rate. Strolling counts for general health, but for brain benefits, you want that moderate intensity, breathing noticeably harder. If you enjoy this kind of evidence-based health content, hit subscribe. We cover research like this every week, translating the science into things you can actually use. The key insight from this trial is that fitness improvements correlate with brain age improvements. It's not binary. More fitness gains mean more brain benefits, at least up to a point. Consider finding activities you actually enjoy. Swimming, dancing, cycling, hiking, tennis, it doesn't matter much which aerobic activity you choose. What matters is that you'll keep doing it. And remember, the study participants weren't athletes. They were regular people, aged 26 to 58, following a sustainable protocol. If they can do it, the research suggests you probably can too. Some researchers caution that brain pad, while useful, doesn't capture everything. A younger-looking brain doesn't guarantee better memory or cognition in every individual case. But the direction of the evidence is consistent. Exercise appears to protect brain structure, and we can now see that protection on a scan. That's genuinely new. The 2025 trial represents one of the first large randomized controlled studies to show exercise can shift brain age markers. Previous research suggested it. This study demonstrated it. So let's bring this back to where we started. You're in that doctor's office. She's looking at your brain scan, and she tells you something unexpected. Your brain looks younger than your birthday says it should, and you know exactly why. You showed up. Week after week, you moved your body, and your brain noticed. That's the evidence, that's the protocol, and that's the opportunity sitting in front of all of us. The question is just whether we'll take it.